This morning in today's checklist, we're helping you navigate medical bills.
Oh, yes. Balancing your health care costs can be pretty stressful, so much so that it actually keeps some folks away from the doctor's office, with one survey finding that 1 in 4 Americans, 25%, delay medical care because of the expense.
So NBC News medical contributor Dr. John Torres is here with us to share some tips on how we try to keep those costs down. Dr. Torres, good to see you.
Good morning.
Morning.
So Dr. John, you say some of the things you can do before you even get to the doctor's office. What are some of the things you should do to prep going in?
And I think the most important point is what you said, that, it's keeping some people away from going to the doctors, which it absolutely should not, because you should be able to go if you need to go or if you want to go for any reasons. But a couple of things you can do is do your homework beforehand, and that means being proactive. And so what you want to do is call the doctor's office and say, approximately how much is this going to cost me? Is it under my insurance? Do you take my insurance? Very important questions. But then you need to call the insurance company and verify that and make sure that the doctor you're going to be seeing is actually in network, because that's a huge important thing. Also talk to your insurance company. What's my copay? What's my deductible? What's my maximum out of pocket? Those things that a lot of us don't really know. So that way when you go in there, you go with all that knowledge and then write all the information down. So after the fact, and I'd write down too who I talked to. So after the fact, you can say, so-and-so told me this is my copay, this is my deductible, and this is my max out of pocket. So that way you can fight.
So you memorialize it.
Exactly.
Yep. And document the cost as well.
And document, that's the cost I'm talking about, the cost of the procedure too. You're correct.
Okay. Once you get the bill, Dr. John, what do you do?
So once you get the bill, first and foremost, the one thing you want to do is make sure that it is in fact your bill, because there have been instances of getting a wrong bill.
Oh, wow.
And you look at it and you say, oh my God, it's a shock factor, but it turns out it wasn't your bill, it wasn't your procedure. And make sure the procedures on there were the ones you did, because doctors' offices, they're run by humans. There can be some mistakes inputting the information. You want to make sure that's it. The other thing, big important thing, make sure it's in fact a bill, because one of the first things you're going to get is called an EOB, an explanation of benefits. And across it, in fine print everywhere, or even big print, it says this is not a bill.
Yeah.
Right.
But often, running a doctor's office, they'll come in and they'll complain about that, and you're like, that's not a bill, that's an explanation of benefits, which has very inflated prices, because those are the prices the insurance company has negotiated with the doctor or the hospital, but then it shows you actually what you owe down. Get an itemized bill from the insurance company. Say, what are they actually charging me for here? And verify that the services were actually done. Like I mentioned, human errors can happen. And if you see something in there that's wrong, appeal. Talk to the clinic, talk to the hospital, talk to your insurance company, and just say, that didn't happen to me. I need proof that it actually did.
Right. So after you do this, you confirm they're correct. Then what?
So the thing you want to do after you do this and after you get these bills is look at it and say, okay, what's the amount? What do I need to do? Can I pay this amount? And talk to if you can't pay it, if your insurance isn't covering it very well, or you don't simply have insurance, talk to the hospital or the clinic about getting a lower cost, because often they will give discounts for early payments. They'll give discounts for cash payments, and talk to them about a payment plan if you need one, and say, is there a way I can pay this in installments?
So you can haggle?
You can haggle
I know,
with them.
it's like a flea market.
You can talk to them, especially if you don't have insurance. And that's a huge thing for people that are cash paying, saying, I'm cash paying, I don't have insurance. Is there a way I can do this on installments? If you have insurance, that's a different story, because you're talking more with your insurance company than with the actual hospital or doctor. And then look for financial aid. There's a variety of ways to get financial aid. There's a variety of things out there you can do, and say, hey, I'm on a limited income. Do you have financial aid at your institute that can help me pay this or lower the cost of this? And oftentimes you'll be surprised that can happen.
For a lot of folks, especially the first time they're doing this can be really overwhelming. And if you don't have somebody to help you, are there places or things you can do to get help to pay these bills?
So there are places you can go to get help paying for it. There's a couple nonprofits. One of them is called $4. It's a nonprofit you can go to, and they can help walk you through it and actually help you pay for these in some instances. You can certainly ask family or friends. I know a lot of people are hesitant to do that because there might be a lot of questions you don't want to answer, or you just feel embarrassed about going to them. But keep talking to them, and also keep trying with the hospital, with the clinic, with the insurance companies, if you have them, and keep saying, can you help me with this because I can't pay it. The other thing is, in 2022, they passed the No Surprises Act. That act is if you're in network in a hospital, or you went to the emergency room, then they can't give you surprise bills. They can't say all of a sudden, boom, you owe all this money. If you need help, just simply do a web search for No Surprises Act helpline, and they will walk you through that if there's any issues on there.
That's
Great tips.
fantastic. Dr. Torres, always great to see you.
You bet.
Really good.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.